Hello, this is Stephanie Roll from the BSU Imaging Sciences program, filming from the X-ray Film Library at Missoula Bone & Joint. When we think about protected patient health information, old patient X-ray films are often forgotten. In this video and companion PowerPoint presentation, we will discuss an overview of a case study article, facts about film, HIPAA guidelines, how violations involving film can be avoided in radiology, and other HIPAA considerations. Starting with the HIPAA case study, we can read about Raleigh Orthopedic Clinic, where 17,000 patients' films were released to be digitized, also known as scanning into an electronic form. The clinic previously signed a contract to release the films to be digitized and then to be taken for proper recycling. However, when the films were picked up, thieves posing as the film pickup staff stole the films. Knowing of the silver they contained, the thieves sold those films to a recycling company. Therefore, not only was the reimbursement for the silver lost, but the films were never digitized, and the patient's health information was breached. After realizing that the digitized images were not received at Raleigh Orthopedic Clinic, they followed the HIPAA breach notification rules, detailed later in this video. But why go through all the trouble of stealing X-ray film? We know from Bouchon's text that the emulsion layer of the film contains silver halide crystals suspended in gelatin. These silver halide crystals result in the formation of the stored latent image by the interaction of X-ray and light photons. The remaining silver halide is then converted to silver atoms during processing. Films fall under the same retention period as other medical records. This is 7 years according to the federal government, or can vary depending on the state government rules. I spoke with our Missoula Bone & Joint Film Recycling Company owner, whose name is Tim Lyons, who stated the current rate for film recycling is 15 cents per pound for double emulsion film and 5 cents per pound for dry view or printed film. With the current silver rate at almost $17 per pound after refinement, the selling of the 17,000 patients' films was quite a profit for the thieves. When talking about HIPAA guidelines, the Department of Health and Human Services stipulates any physical or electronic record that includes the individual's past, present, or future physical or mental health or condition, the provisions of health care to the individual, or the past, present, or future payment for the provision of health care to the individual that identifies the individual should be protected information. The X-ray film blocker includes identifying information like a name, date of birth, provider seen, date of service, but also shows the images of the patient and possibly includes reports of diagnosis. If a breach over 500 individuals occur, the facility should follow the breach notification rule and promptly notify the Secretary of the U.S. Department of Health and Human Services. This may result in an investigation by the Office for Civil Rights, and a penalty may be assessed on the facility for the HIPAA violation. The facility will need to alert those who are affected by the possible breach of their information as well. So what can be done to avoid the situation that occurred at Raleigh Orthopedic Clinic? After a 7-year retention period, the facility should investigate a HIPAA-compliant company that properly destroys films and reclaims the silver, ensuring BPA standards are followed. The facility should sign a Business Associates Agreement, or BAA, like this one for Missoula Bone & Joint, and this with the recycling company should be done prior to the film pickup, and the BAA should be kept current throughout the relationship. Most film recycling companies will supply a certificate of destruction after the process is completed if you ask. Another idea, although time-consuming, is to physically shred the film before it is sent for recycling. This does not decrease the silver's worth and can help the facility safeguard the information. And the facility can upgrade to digital equipment, so there is no longer a need to create hard copy films, and eventually the whole film library will be recycled. Even if using digital images, it is still important to follow the HIPAA standards. Some special considerations will be having restricted access for the PAC system, or Picture Archiving Communication System. Also, ensuring confidentiality forms are signed by the staff and training takes place. Also, the data should be encrypted and sent over secure network lines. The BAA is a crucial piece to making a contractual agreement with the film recycling company. In follow-up with the case from Raleigh Orthopedic Clinic, HIPAA Journal just published an article saying that Raleigh Orthopedic Clinic was assessed a settlement amount of $750,000 for the incident and due to a violation of no BAA being signed. They created a corrective action plan for the whole facility and designated someone to ensure the BAAs were up to date. There was also training of their employees about the policy and procedure. Thank you for watching this video and learning about the HIPAA rules regarding film and Raleigh Orthopedic Clinic's film feed.